Hello YouTube, hello Instagram, hello world. This is Nyla Malone, your Hyde Park therapist, and I am having a casual conversation with Dr. Alfreda Hampton, my OBGYN, and she is gonna, I do love her. She is one of the best doctors that I have ever met on this planet, and she can help you too. And we're gonna talk about bedside manner and the importance of preventative visits.
Seeing your
doctor, okay. And so I'm gonna have Dr. Hampton tell us a little bit about her practice, where you can find her, and then we'll get right into the content.
Okay, so I'm Alfreda Hampton. I trained in Detroit at Wayne State University Medical School, and I became an OB/GYN doctor there. I moved to Chicago and have been here since that time.
Where are your offices
I
at?
have South Loop Women's Center. I opened it in 2002. I currently practice there, and I have another practice also.
Okay, and where's the South Loop? Where's the South Loop Center?
It's at 1933 C South State Street.
Okay, and are you accepting new patients right now?
Absolutely. I love seeing new patients.
All right, and what kind of insurance do you accept?
All insurances.
Okay.
All insurances.
That is awesome. So I met Dr. Hampton when I had something going wrong. And so I got on, I found her on a website, ZocDoc, and when I went in to see her, I was agitated, anxious, and not feeling good about what was going on with my body. And I went to see her, and she made me feel normal. And so can you tell us a little bit about how you make people comfortable, and how you do your bedside manner? How do you do that?
We were talking a little earlier about that, and I just think bedside manner is something that you have to have a passion for what you do.
Okay.
And you have to have a passion for caring for people. And I think someone can sense that. Mm-hmm. Now, you get people that you clash with, but I think in looking for a healthcare provider, you should, number one, get this sense that that person is listening to you.
Okay. Now, I've been in situations where I felt that doctors don't listen, and that would make me not go back to the doctor. How should you respond to a situation? Because oftentimes I think that doctors are seen as people in power. Mm-hmm. You feel a little, shrunk when you're going in. You're going in because something's wrong, mm-hmm. and you're afraid. And you talk to doctors. I've been to doctors, and my mom has been to doctors, and they've talked to her pretty harshly and not mm-hmm. listened to her. So what are things that we can do to kind of combat that, or
I think insurances, healthcare costs, I think all of that is driving the amount of time that a physician spends with their patient. Mm. So some people are really very good at getting across very concisely, very quickly, mm-hmm. What's going on. Mm-hmm. I think sometimes when a physician interrupts too soon, and it might appear as if they're not listening, what they're trying to do is get a particular piece of information that they feel is important. Okay. So I think now we're even being given laptops to put into the room, mm-hmm. And so you'll see some doctors typing as they see the patient to cut down on time. I think what you have to do is, number one, when you go in, introduce yourself, sit down, relax, take a moment, and first hear what the person has to say. First, just listen to what they have to say. Okay. And I think just that moment of listening mm-hmm. will allow to break the ice. And once you break the ice, then you can pull the other information that you're looking for.
So as a patient, should we already have our bullet points ready? Should we pre-write something so that we can get ahead of the questions, or
that's a great idea?
Okay.
I think that's a very, very good idea. When you see a physician for the first time, I think it's a great idea to write down what your concerns are. Mm-hmm.
And
knowing
when
that
it started?
they have it, yeah, and when they started, how it relates to something else, if it's pain, what relieves the pain, if it's bleeding, how long, when. Yeah, that's a great idea.
Okay, number one, write down your concerns.
Write down your concerns.
Yeah, and then answer the questions.
Now that's
concisely.
where your physician comes in.
Okay.
Because if you've written down your concerns, you want to make sure that your concerns are addressed.
Okay, all right. Now, if a physician, it's beyond information gathering in a quick way, it's almost just borderline being rude. What do you do at that point?
Now, see, since I'm a physician, I have to take the physician's perspective.
Of course.
I think that person didn't get out of bed to approach that person the wrong way.
Okay.
Hopefully, their heart is in the right spot.
Okay.
And so I think, number one, if you're feeling that way, you should say it.
I think that's a good idea because
That's the first thing. If someone has recommended that doctor to you, or if you've read about that person, or it appears that person has something to offer you, then I think you should say it.
Okay. I think that's a good idea. So, number one, have your concerns written out. Two, if you begin to feel uncomfortable, just let the doctor know. You have to reclaim your power. You know,
Exactly.
you don't feel dwarfed or diminished by the fact that they have the white coat and they're the expert.
You are in control.
Exactly. See, because when you tell someone like, hey, I'm feeling rushed or I'm feeling uncomfortable, the doctor may, they may apologize and tell you that.
And I think for the most part, that'll cause that person, if they're the physician that they should be, and the physician for you, I think they'll probably step back and say, hey, you're right.
Okay.
Let me start this over.
Okay. So that's a good idea. And also, doctors, I think what y'all get, about 15 minutes in the room? What's y'all deal? Because I know I got a 45 minute.
Yeah, exactly.
But y'all got about 15, you got 12 minutes to state your case, and then they got people stacked up and, waiting and stuff. And so,
but that's no
be
reason that you shouldn't be heard.
That's right.
That's no reason you shouldn't be heard. If that person is really busy, you present a very complex problem, then you simply say to that person, hey, I think this is really important. If there's a matter of test that you like or something different that you like to do, let's schedule this again.
Okay.
But address certain concerns at that time.
Okay. And as far as follow-up appointments, how does that work? Does the doctor tell you when you should come back, or do you tell the doctor when you want to come back? How does that work for follow-up?
I think that's up for discussion too.
Okay, so it's kind of
if it's a real, it depends
everything.
on the condition, yeah.
Okay,
Yeah.
I like that.
And you know yourself, the doctor says, I'll see you in 6 months, and something changes, there's a problem, it's your responsibility to let them know.
Okay.
Yeah.
Number 3, it is your responsibility and your body.
Yep,
So,
you take good care of it. Because things change.
Okay.
You may be thinking one thing, and something different pops up.
Okay.
So,
well, I appreciate that information. So
Yeah.
we got 3 things going on. I've lost track.
all right.
Number one, write
Make that
down,
list.
make your list. Number 2, if you're uncomfortable, state
Say
your
it.
concerns. And number 3, come back when you're supposed to come back. However, if something changes, it is your responsibility and your body. You contact the doctor for when you need to come back and let them know.
Let them know.
All right.
Because things change.
Okay, cool. So we can wrap that part. How's that? We good?
Stop. No shot. I got the juice. I'm the chaser, don't need a mixer. I got the juice. Baby, I'm the plug in the filter. I got the juice. How many damn times got to tell ya? I got the juice. Baby, I got the juice. Down dog. Don't think about it. Down dog. Don't think about it. Down dog.
Yeah, wet dreaming it. Waking up like wean in it. Me and your jeans in it. Yellow like pea in it. Oh no, I mean me in it. No, it ain't lean in it, but it's got a little pink in it. Kinda make you wanna drink in it. Got a little cream in it, but I feel a little bean in it. Work me up like caffeine in it. Dripping like an extra large, but the top is too small. Yeah, here let me wipe you off. Look this side, I can't wait to get you home at all. Nah, these cup holders are small. Can't believe what is in it. Tastes like a good time. My brain was foggy in my business. Yeah, short-term memory fried. Brain on. What you got, girl, is tough as